And good afternoon. Welcome to Ask the Expert with Dr. Walter Tom of Dr. Tom Cosmetic Surgery. And you can find him online at drtomcosmetic.com, Dr. Tom Cosmetic. And of course, he's got offices here in Sonoma County and in Napa, as well as in Maui. And of course, he is your favorite cosmetic surgeon, which is fantastic. He's been voted many, many times best cosmetic surgeon here in Sonoma County, and his estheticians are sweeping up those awards as well, which is really a great way to say that he knows what he's doing, and so does his team. Hey, Dr. Tom.
Hey, Michelle, thank you for being here and
course.
stepping in for Robin. We miss Robin. Hi, Robin, out there in Radio Land.
Robin, hope you're feeling better.
We hope you're feeling better.
Yeah, it's wonderful to have that sort of affirmation from the community, because it means that you guys are doing what you should be doing. You're doing the right thing.
Well, we really appreciate that. Thank you very much. We want to thank all the listeners for voting for us. I want to thank my mom out there for voting for me. And I want to thank Sophie. And so we are once again live at KSRO. And I'd like to reintroduce Sophie Gurian, who is our nurse practitioner, who has joined us, been with us for a year. We are so fortunate. We lured her away from Stanford. Yeah, we got her from Stanford. She came as a special free agent. We got her. And so it was fun to have her, and she just recently has been certified as our nurse practitioner, so we're very excited. Welcome, Sophie.
Thank you, Dr. Tom. Thank you, Michelle. It's lovely to be here again.
Yeah, it's nice to see you.
Yeah.
Thank you. So, Sophie, you've been with us for a year now, and I love sort of your youthful energy and looking at things differently from this baby boomer guy here. And I thought today it would be interesting to get some of your insights that you've kind of picked up over the year with us as to what are your top 3 favorite skincare treatments.
Yeah, absolutely. I'd say staying at the office for the past year has taught me a lot. And so to transition into the top 3, things that we should focus on that's really important to me and what I try to hone in for my patients are, well, I guess we'll start with number 1.
Let's start with number 1. Okay, I think that's good. See how smart she is? That's why we hire nurse practitioners. Okay, number 1. What's number 1?
You've heard it before, and I'll say it again, preach it. For the people in the back, sunscreen. You definitely have to wear sunscreen, even if you feel like it does nothing. It does do something.
What does it do?
It prevents aging. I mean, the number 1 culprit for premature aging is sun exposure. So if you are in your teens or in your 20s, it's better to start preventing wrinkles and fine lines from forming now versus later in your 30s and 40s, and trying to reverse that sun damage.
So how long have you, Sophie, you obviously, you're academic, you've done a lot of great things, nursing school. By the way, Sophie is a local young lady, and then went off to do a lot of her schooling as an RN, a BSN, and now a nurse practitioner with us. You're still young though, and I look at you compared to me, and so
you're still young, Dr.
I'm still young. Okay, she had to say that on air. Okay, but Sophie, in terms of just saying, it prevents aging, and sometimes older people look at somebody who's probably in their late 20s or whatever, your age, and they're kind of like, well, what do they know about that? And and is what they're telling me valid? And because how would they know? Do you see a difference in your type of skincare that you do compared to your peers? Are you noticing a difference yet? Did I make that clear? Maybe I didn't make that clear. Let's go back. So you how old are you, Sophie?
I'm 29.
She's 29. You're 29.
Last year my 20s.
Oh, God.
I'm holding on for dear life, guys.
God. All of you out there in KSRO land, you got to feel my pain. I've got these young team members. I have one who's 27 who keeps on lying that she's 25, and I have one who's 29 bemoaning that she's going to be 30. They're killing me. But so Sophie, if you look at other your friends who are your age, okay, do you see a difference yet in terms of you taking care of your skin versus those who don't take care of their skin?
Yes, I think I do, and it mostly shows when we go out.
Okay. Well, I want to hear about it. When you go out, what happens?
Whether we're, getting a drink at a bar or at a restaurant, I find that I do know I have younger looking features, but I tend to be the one at the table being carded versus the rest of my friends, and they're only a year or 3 older than me, 3 years older than me, and so it's kind of funny. They're like, well, what about me? Are you gonna card me? And I'm like, yeah, card them, but it's because people think I look a lot younger than I really am.
Right.
And so I think this is going, if I continue doing what I'm doing now, I can't imagine what I'm gonna look like when I'm in my 40s or 50s.
Oh,
know?
when you're that old.
Oh
my God. See, Michelle.
Are you sure you want me to keep talking?
We're recording this for YouTube as well, but
This is
they're
amazing.
killing me here,
It's so
Michelle.
good. But I love what you're saying, because I learned about, actually from a boss of mine, about the importance of moisturizing daily and using that sunscreen. Sunscreen's so important when I was about 27 years old, from a boss of mine, actually in radio, which is crazy. I don't know why she told me that, but she did.
Yeah.
And I was like, all right, I'm going to do it. And I started doing it, and I am 50 now. I was carded up until 45. I would get carded for buying alcohol at a grocery store until I was 45 years old.
That's great.
So even with a little bit of graying hair, like that skin condition is really important.
That's absolutely true. And so those who are going to be listening or watching this on YouTube, because we are recording it as well with our live broadcast here on KSRO, I'll tell many people, they may see Sophie and realize that she's Asian and Filipino, and they say, oh, well, she's Filipino, you know, and so maybe it's the Northern European person will say, well, they got great skin, they always look young. And what I tell people is the following. For instance, you might say the same thing about the Latinas, okay? Or let's say Mexicans locally here, or Hawaiians, native Hawaiians in Maui, at our Maui office, and I use this example. Who looks healthier and looks younger? The 40-year-old surf instructor or the 40-year-old Hawaiian who works in a bank? Who looks younger? The 40-year-old Latino who is working in the fields versus the 40-year-old Latino who's working in a bank? And I think we all know that answer. And so I bet, because Sophie has this particular interest, and I'll tell you a little bit more about Sophie in a minute, about skin and protecting her skin, is that she's going to be effervescently younger looking than her peers. That's just going to happen, Sophie, so keep it up.
Well, I hope they join me in keeping young.
And I think they will. The younger generation, it's funny. So my daughter is 38, gonna be 39 next week. I gotta have a 39-year-old daughter. I've got a 40-year-old son, and so she's an instructor at the Santa Rosa Junior College, and she has some younger students. And she's just related this story to me, my daughter, that they have made a comment about her looking so young, and then they were kind of whispering to themselves and giggling, and they said, "Oh, I bet you she uses sunblock." And then they went on, and then my daughter got involved in the conversation with them, and they were, and they knew all about sunblock, about what the important ingredients are. So what really made me feel good about that kind of funny little exchange between them is that maybe the younger generations can be smarter than the older generation in terms of taking care of themselves. Are you finding that, Sophie, in the office, in terms of who is more accepting in terms of good skincare?
Yeah, absolutely. I definitely see people in their 20s and 30s being a bit more mindful and aware when it comes to using sunscreen, and I think a part of that has to do with the influence of their parents, because now their parents are kind of reaping the effect from being a sun worshiper back in the day, and so their parents are suffering from that exposure, and now are even sharing that message to their kids who are my age, and they're telling them, you need to protect your skin.
Absolutely. So, you know, we've talked about this a lot here, and they may say, oh, geez, we're tuning into Dr. Tom again, and they're talking about sunblock. But that's so important. When we go to get sunblock, of course, you know, you could maybe go to the local department store, or you come to our office. What are the key components that, or key instructions that you give your patients when they're looking at our sunscreens?
I tend to tell them to look for sunblock that has zinc oxide and titanium dioxide. You definitely want to have something that's full physical, that's going to protect against UVA and UVB rays. So if you're new to purchasing sunscreen, those are the first 2 ingredients I would definitely look at. And go ahead and reapply every couple hours if you can. I know it can seem a lot, you know, but it really is doing you a good benefit in terms of for prevention.
Yeah, and so Sophie's correct. You can hear her very academic talking about zinc oxide and titanium dioxide, and those are metals. And those are really the two active ingredients of actually blocking sunlight in terms of the harmful aspects of sunlight. So that's really important. Thank you, Sophie, for that. And for those, especially ladies mostly, who wear makeup, is reapplying makeup that has, a lot of times they have those type of mineral makeups that they can purchase as well, and reapplying that. So that's important. So sunblock's number one, so prevention.
I do have a couple more things to say about sunblock.
Excuse me. Okay, I'm going to let
I think
Sophie.
it's really important. You know, I used to be somebody who wears a lot of foundation, even when I was going to work a 12-hour shift at night, you know. But I got in my skin to a point where now I feel empowered and confident enough to just wear like a tinted sunblock and not need foundation. Maybe concealer to touch up on some of my acne scars, but to know my skin is in such a condition that's healthy and glowy and youthful, where I don't need as much coverage, it makes me feel really good. And I want everybody to feel that way. So
that's a great point. Thank you for, by the way, interrupting me, Sophie. No, thank you for interrupting me. Anytime. Oh my God. Okay. So you can, but it's a great point, and it's actually what we discussed at our morning meeting today. And we were talking about the good old Baywatch Pamela Anderson, and it was more of, she used to be known as Pam Glam, right? Glamorous and a lot of makeup and, you know, all of the kind of, you know, she was bigger than life, and we'll just leave it at that. But in terms of her face, and recently she got an award and she showed up with no makeup on her, very minimal makeup, and she looked great. And
she did.
And she looked great. And that is absolutely a move. We are now realizing that good skincare, having healthy skin, is important. And one of the telling tales of somebody getting older, and I'm going to talk about ladies who wear makeup, is when they start putting on more and more makeup.
Yes,
okay,
absolutely,
that actually is aging. So having good skin, not just at the old age of 29 like Sophie, but as we get older, you can help yourself to continue to look healthier, therefore more vibrant, therefore more youthful, by taking care of your skin. And the first thing is sunblock. You said there were two things. Was there another aspect of sunblock you wanted to mention?
Yeah, and I actually wanted to just add on to what you said. I did have a patient who came in originally for a consultation, and she was wearing makeup, and I took her photos, as we usually do before any treatments.
Right.
And then she got a laser treatment with me. We put her on some really good skincare. She's really diligent about wearing her sunblock. After a month or so, we did take post-treatment photos, and her skin looked so much better without makeup in comparison to when she first came into the office with makeup. And there was a significant difference. I'd say maybe 5 years. And that was, at first she was like, I couldn't tell the difference. But once we showed her before and after photos, she knew there was a significant change in the health of her skin.
Great stories. Those are real stories, and as to what happens, and it really is. I feel very passionate, and that's been a change for me in the last 3 to 5 years in our practice, where we knew it was important, but now we're really stressing it. And the cool thing is, it can be some of the least expensive things that you can do to help yourself to look healthier, therefore more youthful, vibrant, more handsome, prettier.
Yeah.
What's number two?
Number two. Sorry. Okay, moving on. The second skincare advice that I have is, or what you need, is retinol. If you don't have retinol yet, you definitely need to add it in your skincare regimen. Do you want me to elaborate on retinol?
I guess so.
Yeah.
Sophie's taking over the show. Go ahead, Sophie.
All right.
Tell us about retinol.
So retinol is a derivative from vitamin A. It essentially helps increase your cellular turnover. Our turnover slows down starting in our 20s. We lose about 1% of collagen, and so that's why we don't see that glowiness, that rejuvenation as quickly as we do, back then in our 20s and our 30s. So stop laughing, Dr. Tom.
Sorry.
I don't know if he's making fun of me or...
The radio people can't tell, but I'm sitting here and I'm kind of smiling or smirking. I guess that's not really very polite of me. And she's talking about being and getting older in their 20s
Michelle's
and 30s.
like turning pink just from laughing over
I'm
there.
sorry, it's so funny. It's great. I love it. I love
All
it.
right.
This
Last
is great
week,
tip.
last
It's
week.
very good.
All right,
So retinol will definitely help thicken your skin. It helps stimulate that natural exfoliation process. So you're shedding off that dead skin cells on the top while maintaining that strength, that elastin, that collagen production on that middle layer of the skin. So we're trying to keep our skin at bay and work against the aging process in a sense. It can help with acne. It helps with pigmentation from either acne scars or sun exposure. It helps with the strength of the skin so that it has more bounce back and it can be a bit more resilient. I mean, after starting my retinol journey, I found that my skin is definitely a lot more thick. You know, I can definitely see it in the way I put my makeup. My canvas is just a lot more smoother. My pores are smaller. I mean, I would drink this stuff if I could because it's like the key ingredient. Okay.
That's fantastic. And so for those who have been our regular listeners, and every show I want to make sure that I thank our regular listeners. So thank you. But you've heard me, besides Sophie coming today, you've heard us bring Bridie, our medical assistant, a dermatology medical assistant. We've had Karina, who's come in, who is my medical assistant, surgical assistant, as well as Faith, who is our patient coordinator and licensed esthetician. And these are younger staff members, and I jokingly call it the new way that we're doing our show, Beauty's and the Beast, and I guess who I am, I'm the Beast. But when you listen to each one of them, you hear them talking about Retin-A or retinols, okay? And so it's not that it's just the company byline. This is something that they actually believe in. And one of the, again, where I guess we're being very Hawaiian. We're doing talk story now. But one of the stories that Bridie did not mention on the air, and I mentioned it in a previous show afterwards. We'll get Bridie back on here. But she told me about her grandfather that she spent a lot of time with, and he had some dermatologic condition, and they recommended putting Retin-A on the sides of his eyes. And so he did that, and as he got older and older and older, Bridie noticed as a young girl that he looked older and older and older, except around the side of his eyes. And therefore, she became, zealous about it and used Retin-A. So for those of you, we're going to move on because I want to get into some of the services that Sophie actually provides at our Dr. Tom Cosmetic Surgery. But Retin-A is key, and you heard it here. Sophie said if she could drink, she would drink. We do not recommend that.
No,
that's not how it is. Okay. So Sophie, number three. What are we doing?
So once we got some good skincare products in line, we have a good regimen, we're using our sunscreen, I suggest starting off with a medical skincare treatment, whether it is a chemical peel that you can get done with our esthetician Hillary, or a microneedling session with me or one of our other nurses in the office.
So tell me about, so we talked about pills just recently, so we'll kind of skip over that a little bit if we may. Let's talk about microneedling. And one of the very first shows that we brought you on when you just started with us, and I throw them right into the fire, everyone, when they come, and you get them right here on the show with us on Ask the Expert. You had mentioned microneedling, and you even shared some of your own personal experiences with us. Tell me a little bit, let's just pretend the audience doesn't know anything about microneedling. What is it? Why should they do it? What does it entail?
Yeah, microneedling is minimally invasive. You come into the office, we numb you. You essentially can expect, let me start all over, Dr. Tom. I'm sorry.
Let's start over. Okay. Can we put it on rewind, please, Michelle?
Rewind.
Live.
Okay, we're live. Oh, sorry. Okay.
Why don't I just start off with my own story? I had suffered from really bad acne. I had some acne scarring, some hyperpigmentation. I needed something a bit more aggressive to help kind of give me a restart on just my skin, my canvas. And that's when I found out about microneedling. We essentially use a skin pen that has about 20 little needles. and we needle your skin, creating these little microchannels. This stimulates a healing response, so your body sees this controlled trauma, if you will, and it tells your body to rejuvenate the skin from the inside out.
Right. I think, and the good point here, what Sophie's mentioning, you talked a little bit about trauma, and you're like, whoa, wait a minute, I'm a patient. What do you want? You're going to traumatize me. So number one, and she mentioned it the first time before we reset, that we put a topical anesthetic on the skin. So so this is a very, very tolerable procedure. I've had it done on me, and it certainly, I didn't find it uncomfortable at all. Maybe a few spicy areas, but that's about it. And so when Sophia is doing this procedure, she's putting on a hyaluronic gel on your skin and sliding the pen across your face. And these 20 needles or so are creating these micro tunnels or channels, as Sophie mentioned, and that's trauma. And the comment that I want to make was the late Larry Shaderock, who was one of the very first cosmetic doctors or surgeons here in Sonoma County. That was one of his famous lines that he would tell his patients. He said that, we're going to do this procedure. Basically, we're traumatizing something, and if nature is good to us, you're going to look better. You're going to heal, and you're going to be stronger. Sort of like a bone that's broken, and when it heals, it's even stronger, okay, at the break because of the callus formation that occurs there. So that's kind of the concept. So you talk about doing this microneedling. How long does it take to do that, Sophie?
You can expect to be in the office for at least an hour and a half, because we have to numb you. Once you get all the numbing off and we've taken your photos, the needling portion takes about half an hour, depending if we're just doing your face and or any additional areas like your neck or your chest. So
okay,
and
so as you're doing this, and having this done, can they just go right back to work, or is there some cosmetic downtime? Because everybody wants to know about cosmetic downtime.
Yeah, you can definitely expect some downtime, probably up to a week if it's your first time, maybe even up to 10 days. I just like to plan for an even longer downtime so you're not surprised. You will be a little pink, maybe a little scratchy, red, so definitely stay out of the sun if you can. I mean, you should. I'm not even going to say if you can, you should. Okay. Use a gentle cleanser, a gentle moisturizer, your sunscreen. Part of this procedure too, which I wanted to touch on, is that we do use your platelet-rich fibrin, your PRF. That essentially means we do draw your blood into a little tube, spin it so that we have your growth factors and your platelets, which is what you like to say, the paramedics of the body.
Right.
I've been listening. Okay. And we're taking those paramedics and we're applying it on an area that can really utilize it, which is your face. And then we needle that goodness into the skin, and that's actually promoting even more rejuvenation, regeneration of the skin. It's promoting new cellular growth, and it helps with the healing process, most importantly.
Okay, and so it's going to build
collagen.
Collagen, very good.
Ding, ding.
Yeah, yes. So it's going to build collagen, and what's going to happen to the texture of the skin? Is it going to smooth it at all, or with these little holes? Is it smoother or is it rougher?
Well, after you're done healing, you're definitely going to notice a smoothness to the texture. I'd say if you're somebody who feels like you're a bit more dull, the skin's a bit roughed, it just needs some exfoliation, your pore size is a little, bigger than what it used to be, go ahead and try microneedling. You're going to see a difference in your texture, but definitely after 3 treatments.
Okay, so we're going to do 3 treatments. Now, you got me a little bit frazzled here, Sophie, because I'm thinking about signing up for this, have you do this, and you're telling me it's going to take a week of downtime and maybe 10 days. And I'm thinking the last time I had it done on a Wednesday after hours. And then I showed up at KSRO the next day and I did our talk show right now, Ask the Expert. So when we talk about downtime, what's your definition of downtime? Because I found for myself, I just sort of carried on with my daily activities.
Yeah, I mean, it's not in a sense where your life has to stop. I mean, I don't recommend working out for the first 24 hours. Just, be gentle to your skin, let your skin heal, at least for that first 24 hours. But as far as running your errands, being able to go to work, go to school, you can still go ahead and do that. You don't need to be on any medications, hide away from society. I like to put on tinted sunscreen to just help give me a coverage, and I'm kind of really on my way. It's more of the aesthetic downtime that I was referring to.
Okay.
Some people end up being a bit more, pink longer than others.
Right, okay, so...
Would you also be careful applying makeup during that week afterwards? Maybe not as much makeup, just to give your skin a chance?
Yeah, I would just be mindful and watch your skin heal. If you can just wait 3 to 5 days, I think the longer the better.
Mm-hmm.
And then we kind of go from that for your next treatments.
So for our listening audience, I think you can see that's the difference in terms of just people's sensitivities to what we might call cosmetic downtime. For me, I had it done and I went back to work just the next day and put, of course, good skincare and sunblock on. And Sophie as well, but then she's concerned about somebody who maybe if they're a little bit taken off by being a little red, their skin looking a little bit swollen, those things can occur. And so she's probably accurate in describing that, but that's, in my opinion, not something that keeps you from living your everyday life, but you just gotta know you don't wanna do this 3 days before your wedding.
Yes. Oh, is that where you're going? Yes, don't do it before.
Yeah, we're not going
2 weeks. Give it at least 2 weeks.
Yeah, give
to
yourself
heal.
a couple of weeks to heal from this.
I mean, some people, are bruised or say tend to bruise. So if you can take arnica at least a week before just to set your skin up to heal even better, then go ahead and take that arnica.
Okay, so I'm frustrated because we have 1 minute left. We're going to close up the show,
so much to
and
talk
I know
about.
there's so much to talk about. So I'm frustrated because I'm going to have to ask Sophie to come on back next week, and she can kind of boss me around on the show a little bit more. But no, I really want to hear more about what other skincare treatments. So we're talking about protection with sunblock, taking very good care of that with Retin-A, and microneedling. So I want to thank everybody for tuning in to us. And Sophie, will you come back and join me next week?
Sure.
All right, we got her. Okay. Thank you, everybody.
Yeah, right on.
Thank you,
could,
Michelle.
of course, you can check out more information and sign up for a free consultation at drtomcosmetic.com. And we'll see you next week here on KSRO.
County's News Talk,